Sure. Thanks, Dudley. Good morning, good afternoon, good evening, everyone. Happy to be here. So I was asked by Dudley to give an overview of the work that's currently ongoing in terms of migrating the OneHealth tool to an online platform. Can you see this in full? Just making sure if you can see it in full screen.
Not full screen, but we see
not
this.
Full screen. Okay, hang on.
Yeah.
Let me just do this. Do this. Do you see it now in full screen?
Yeah, exactly.
Yeah, okay. Problem of working with double screen sometimes. So so my name is Karen Stenberg and I work at WHO in the Department of Economic Evaluation, Department of Health Systems Governance and Financing. And I know many of you. It's great to see many familiar faces and also to meet new people. And I heard many exciting, I learned a lot yesterday about all the ongoing work in different areas. So really enjoyed yesterday's discussions. I have been part of the group that has developed the OneHealth tool since the inception in 2009. So I have a very good historical memory of it and am still engaged and leading the work that's ongoing right now, where we are migrating the tool to an online interface. So as you can see from the title in the slide, we're working towards an online integrated health tool. So you're getting a heads up already that once we have the first version ready for launch, it will also be rebranded. So we're going to go from OHT to IHT. So I know that many people on this call are highly familiar with the OneHealth tool and have used it many times and to support countries, but there might be colleagues who are less familiar with it. So I just thought I'd give a quick overview of the tool as well in this presentation. So we've had the OneHealth tool for about 10 years now, and it's really intended as a UN flagship tool to support planning, impact analysis, and costing. And it's really the global leading tool which looks both at health systems in a comprehensive way as well as service package resource needs. The purpose is to link vertical program costing such as NCDs with broader health sector plans and UHC. So that's sort of the overarching aim, although that we know that for many investment cases, only parts of the tool are used. We have a very strong governance mechanism for the tool. Colleagues on this call from different agencies are supporting the tool through an interagency working group. And as you know, the tool also includes not just costing, but also impact models. The tool has been applied in around 60 countries to date. We probably should compare notes. I was really impressed to see that slide yesterday with all the country applications, because in our team, we're not always aware of all the applications, given that it's an open access tool and anyone can download it and use it. So we may need to increase this number, but it's still a solid number, at least 60 countries. And we've seen that it's become a principal tool used by the UN Interagency Task Force for NCDs to estimate some of the numbers that are presented in the country investment cases. So that's why we have this session at this meeting, and really look forward to discussing with this group on how we can better meet the needs of the task force and of countries in particular. The tool is also used at the global level for various analyses. So, I mean, this meeting is about investment cases, but just to keep in mind, I mean, when we talk about the OneHealth tool and what it can do and what it cannot do and whether it meets our needs, we just have to keep in mind that the tool was really developed to feed into a number of use cases at country level. So initially, it was really developed to support national strategic health plan costing, so number one here, as well as sub-national plans or sub-sector plans for one area. But then we saw quite frequently a strong pickup of the tool for investment cases. And here, I mean, just initially, I think NCD has been the area which has really picked up the tool and is using it for investment cases. There's also some other areas like the Global Financing Facility for child and maternal health, for example. But we're really seeing this use case pick up as well. So these two areas in green are really the most frequent use cases that we see. But then again, we have also built a cost effectiveness functionality into the tool. So it has now also been used in some countries for priority setting or cost effectiveness analysis. In a couple of countries, there's been requests to use the tool for health package costing or benefit package costings. And then finally, we are also exploring right now how we can also strengthen some of the outputs in the tool to support budgeting processes and in particular program-based budgeting. So the outputs from the tool will need to feed into all these different exercises. And here, just to remind ourselves, some examples of where the tool has been used, both at country and global level. It's really featuring in a lot of analyses that have been published, both in journals as well as in the grey literature. So as many of you know, the tool consists of multiple interlinked modules, and I think that's important for our discussions today, just to make sure everyone's on the same page here. So in this image, we can see the different modules presented. And on the left-hand side, as we can see, there are different disease or program modules. There's also at the bottom there 6 health system modules, as well as a module or a functionality for calculating the financial affordability or financial space. And on the right-hand side, we have health impact modules, which allow you to calculate health outcomes. So service targets or coverage targets can be set in the program modules for costing, and then they are sent to the impact modules, which calculate the health impact. Now, it's very important to keep in mind that the governance for these modules is a bit different. So the modules for costing and planning are governed by the UN IAWG agencies. So WHO, UNDP, UNICEF, UNFPA, UNAIDS, and World Bank. And the group meets regularly to discuss the methods used for costing and planning and what denotes the boundaries of the health system and how should we model health system investments. The modules for health impact, on the other hand, are governed by various stakeholders. So WHO does govern some of them, notably the NCD module, and holds the intellectual property rights for this. But there are other groups that have developed the other impact modules in the tool. So when we want to look at maybe, expanding or updating some of these modules, we need to consider which group has the property rights, intellectual property rights for the different modules, and what kind of collaboration can we engage in with different stakeholders to make sure that whatever is there in terms of impact modeling meets our needs. And of course, we could also add additional impact models to the tool beyond what's there today. So last year, we started the process of migrating to an online environment, and the purpose is really to enable more rapid data analysis, transparency, and collaboration. And the rationale here is to meet demands for further expansions in the scope of the tool. So right now, we felt that we were a bit working on the limit. Sometimes if you run an analysis, it takes a little bit of time, and we wanted to improve performance. Another reason is we want to increase interoperability with other systems. So if there are other tools or systems out there that are developed by other stakeholders, is there a way we can incorporate them into our modeling and work together? And also, when we have an online system, we can share the code and we can actually increase collaboration and work with different partners, which will speed up improvements and also open up the development process to a larger range of developers with whom we can work. So as I mentioned, the tool will be rebranded when the first version becomes available sometime this year. So it's a phased process, you know, taking every module and shifting it to the online platform is not just a simple replication, but we are also looking at what are the ways in which we can improve the tool when we migrate it. So we are now in something we call phase 1. And here, as you can see at the bottom, there's a table here. And so you can see in phase 1, we're really looking at building the core architecture of the tool, the demographic model. We have selected 3 health system modules, and we are working with a couple of health program modules at the moment. And we're also building in financial space. So this is sort of the migration of existing content. And on the right-hand side, you can see we're also creating new content during this phase. And one of the new models is Tax Sim. It's a model that simulates the implementation of health taxes. So in the first version, the current version we're working with is on tobacco taxation, but this year we're going to expand this to include SSB and alcohol. And here we're working with the taxation team, the tobacco taxation team at WHO. And then we're also building an emergency preparedness and response module. And then, as you can see, there will be subsequent phases once we've completed phase 1 and pilot tested the product. So just to highlight what will be covered in phase 1. So as you remember, this is sort of the architecture, we could say, of the tool. And here we can see everything that's covered in green is either already available in an online format or in the process of being programmed under current contracts with the provider, which is Avenir Health at the moment. There are other, it's not just Avenir Health, I should say, because also there are other providers that have been contracted to model the NCD impact model as well as the Tax Sim model. But as you can see here, in terms of what's currently being migrated and should be available sometime around middle of this year, we will have 3 modules in terms of programs. It will be HIV, TB, and NCDs and mental health and substance use. And then we will have 3 health system modules, as well as the new emergency preparedness module. And in terms of health impact, we will have, in addition to the demographic projection model, we will have the list tool is already available online. There's work ongoing to rebuild the NCD impact model online, and I have a slide with a bit more detail on that. And we have ongoing work for the TB and HIV components. And then Tax Sim Impact, which is situated a bit here between costs and impact, is a tool that allows you to model taxation, so the health taxes, and then the outputs from that model will feed both into the impact side as well as the financial space or fiscal space assessment in terms of the revenue that's generated. So what are some of the specific updates ongoing? So we're improving the user interface. We're improving the technical content. For example, service delivery platforms are now consistent with the WHO UHC compendium. We are improving consistency between different areas in the tool, such as program activity or program support costing. And we already have a lot faster processing speed than what we have in the desktop version. So a slide specifically on NCD, since many on this call might be particularly interested in this. So many of you may know that WHO has updated Appendix 3 of the WHO Global NCD Action Plan. And following this work, we are also updating the NCD impact module in the OneHealth tool, or let's call it in the new integrated health tool. So this includes an increase in scope. For example, we'll include additional interventions such as pharmacological interventions for tobacco cessation and promotion of breastfeeding. The WHO cardiovascular disease risk charts are in the process of being updated, as well as the risk threshold. The effect sizes will be updated, and there will be a new impact model for cancer-related interventions, which allows modeling for a much wider range of cancers. So this is currently ongoing, and we really look forward to having this new improved module available. So this is one of the examples where the migration, it's not just a replication, but it's really looking at ways of improving the module. And I can already say right now that we will have a first version of this NCD module sometime in a couple of months' time. And the scope for that has already been determined. And if there's interest, we can discuss to make further improvements to the NCD module. That can also be handled in a subsequent phase once we've piloted the first version. Another component to mention is EPIC. I think this group has been briefed about the EPIC tool before, and just to mention, it's a tool developed by our team, which really looks at how changes in health status would affect the size of the labor force and the accumulation of capital. And so you can use this module to calculate how GDP would grow and compare two scenarios. This module would be very, very relevant for doing investment cases. Now, EPIC was previously available in Excel format, and it has been migrated now to an R code. So for those of you who know how to read R and would be interested to use it, we are currently looking at different pilots for this version of the tool. And once we're happy with how the tool performs, there's a plan to build EPIC into and integrate this into the online integrated health tool sometime 2024-25. EPIC has been applied to date for different areas such as TB vaccine, malaria control, universal health coverage as a whole, and then also working on cancer right now. So this is something that this group could use in the current format or could look at, once it becomes integrated into the IHT in the future. So some of the, I also wanted to address some of the challenges and limitations that I heard in yesterday's discussions. So unfortunately, I wasn't able to stay for the full meeting yesterday. I was sort of dropping in and out, but I was taking notes of the things I heard. And some of the comments I heard yesterday were related to scope. So I think I heard suggestions to expand the OneHealth tool and include more health areas or interventions, and to build corresponding cost and impact modules. I also heard suggestions to build more interventions and also build more impact modules. For example, there are areas where the tool can currently do costing, but there's no corresponding impact module. And I also heard suggestions to maybe look at expanding the range of health conditions or health outcomes covered. I think there's a comment made for alcohol modeling in the tool. So specifically on these on the scope, I think, sorry, I just need to plug in my laptop because it's going to die. Yes. In WHO, we have the UHC Compendium, which is a database of health interventions, which we are looking at drawing on for expanding the list of interventions in the tool. When it comes to building new content, we hope that having the tool in an online environment will really facilitate us to work with different partners. And I'm sure there are partners on this call where we could discuss you know, how we could collaborate and link different modules up through different systems. When it comes to methods, I would be interested to know if there are specific suggestions from this group.
En fait, ça là,
in terms of improving the methods in the tool. I mean, I know there were comments around cost-specific versus all-cause modeling, and of course, that's something that can be looked at improving for some areas. I know there were also comments that it's a data-hungry tool, and I think that's very much related to the methods. I mean, we have tried to build something that is user-friendly, transparent, lets a user drill down and change assumptions to the inputs. But it's true that some users can feel that it's a lot of data to go through and assess. But users always have the option, of course, to use the defaults. On transparency of the methods and assumptions, we need to make sure users are comfortable with the approach, and any suggestions that this group might have for that, be interested to hear. And then on the interface, we're also hoping that the online migration will help with this. So we think there are these opportunities presented through the migration. And one of the things is we are trying to improve the kind of user journey through the tool. So this is a screenshot from the new beta site, and we think even as users enter the tool, there's going to be options for how they can, you know, decide what they want to do. So you might want to do a comprehensive health sector plan, or you might want to do a specific program plan or investment case. So this middle box here could actually also include the user journey for an investment case, and we could have specific steps that are suggested for the user in terms of in which order they need to fill data into the tool. So that's something we're looking at now, really facilitating this user journey. And this is my final slide. So just in case you're all wondering about the timeline. So we started this work in May of last year. And here it says early 2023, but it might be second quarter or mid of 2023. We'll have to see how the programming goes. But by that time, we hope to have a prototype online IHT that includes HIV and TB, and hopefully most of the NCD intervention costing, impact modeling for NCDs, as well as list, so maternal and child health, HIV and TB. And then you'll see there the system modules as well. So that's what we hope to have by Q2 or, you know, mid 2023. And then by the end of this year, we will further work on the tool and expand it and adding more interventions and health system outputs. And then the work will continue in 2024-25 with further developments. So just to reassure everyone that while we are doing this migration, the desktop version is still there and you can still use it for your analysis. However, in some areas, the online version will be more advanced, such as NCD or cancer impact modeling, including health taxes. So once the new version is available, it would be good if we can arrange some kind of outreach to this group, Dudley and Nick, to share the news and make sure that everyone's aware of what's available for the modeling. So that's basically what I wanted to share today, and would really love to hear suggestions from this group on your thoughts on how we could further improve content now that we are migrating to this online platform. And also if there are specific areas where you would like to contribute, please feel free to reach out to me, separately after this meeting as well. We're always looking for people who can work with us and make sure we really develop the best possible tool. Thank you very much.